February is Heart Month, and did you know that our hormone levels could affect our heart health? Here with more is Dr. Clark Hansen from the Hansen Clinic of Natural Medicine. I did not know that. Good morning, Dr. Hansen.
Good morning, yeah.
How does that affect our heart health?
It's huge. There are more testosterone receptors in the heart than anywhere else in the body. And a lot of women don't know they even have testosterone. I think it's just, something men have. But if your sex drive is low, that means your testosterone is low. And if your testosterone is low, it means you have a greater risk of dying of a heart attack. It actually protects the heart. The heart's the most active muscle in the body. Testosterone builds muscle. It also prevents cholesterol from building plaque in the arteries. So it actually lowers cholesterol, raises the good HDL cholesterol, and protects the heart from a heart attack.
Testosterone
does. So that's a critical hormone. And women think, okay, men also, my sex drive is going down, I'm just getting older. And just think, well, that's just an aging thing. But it's really important for your health to keep your testosterone level in the optimal range.
Well, you mentioned low sex drive as one symptom. What are some other things that we should look for?
Well, let's look at a slide here. So low sex drive, most people know, but also sexual sensitivity, persistent fatigue, loss of muscle, increased abdominal fat, just weight gain around the abdomen, and heart disease, but also moodiness, depression, and anxiety. Testosterone is a natural antidepressant. We could get most people off Prozac and all those antidepressants if they just got their testosterone up to the right level.
And you will check the blood levels on folks. That's how you definitely know where their levels are.
It's so critical. Look at the whole picture, because if testosterone's low, there are probably others that are out of balance too. Getting that symphony of hormones balanced is critical. So a patient of mine, we'll call Jan, we'd like to look at her symptoms. She was 56 when she came to see me. She wasn't this happy when she came at first. She had all kinds of things going on: hot flashes, vaginal dryness, low sex drive, depression, anxiety, aches and pains, the weight gain in the abdomen, and memory loss. And you just think, oh, those are all just getting older, but most of those are testosterone low symptoms or estrogen. And the last one, pregnenolone, the memory. Most women don't, or men don't know they even have a hormone called pregnenolone. But we look at all these hormones, and in her case, a lot of testosterone hormones. And of course, sex drive, you just think is going low, and the husband's also. But you get those balanced, you protect your heart, reduce your risk of cancer, heart disease. Those are the two main killers.
Doing quite a bit by getting your you have to get them balanced, though, your hormones.
Exactly. The balance is important. You can take too much, but testosterone's kind of gotten a bad rap because it's been abused by bodybuilders and athletes to get that super performance. They take 10 times too much. And you get it in the optimal range, and you actually reduce your risk of dying of a heart attack. So it's critical. In case of Jan, we'll look at some of her test results.
To see how they changed once she was on there?
Yeah, look what her test results initially. Everything was out of balance, either too much or too little. And her estradiol was way too high. That's the estrogen that's bad for you if you get too much. It can cause cancer, because she was taking an estrogen drug, estrace. So we got all those balanced. You can see at the end, her testosterone came up from less than 12 to 67. She felt great. Her sex drive was back. She was having hot flashes every night, 2 to 3 times, 5 to 6 times every day. No sex drive. It was painful having intercourse because lack of secretions, and just getting all that balance, you just feel great again.
And I'm sure a lot of people are watching right now thinking, yeah, that's how I felt. I just wrote it off to getting older. So you have a special offer. So this is a good time for people, especially with the Heart Month.
Yeah, we want to test everybody's hormones and make sure get them in balance so they can feel great. So if you go to our website, you'll learn all about this and sign up for the newsletter. It's free. If you sign up, you'll be registered for a drawing. We'll give away a free testosterone test to several lucky winners.
Wonderful.
So learn more, come in, get tested, and get feeling great again. And then you're going to send your husband in, because he's going to say, I want whatever she's doing, because she's awesome.
Thanks, Dr. Hansen, and your friends, too. So if you would like more information about the Hansen Clinic of Natural Medicine, please go to Dr. Hansen's website. It's drhansen.com, or you can call the number you see right there on your screen.